Good afternoon, everyone. I'm Nirav Shah, Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be able to join you this afternoon to talk with you about where we stand with respect to COVID-19 for across the state of Maine for today, Tuesday, February 9th, 2021. And I begin my discussion this afternoon on yet another sad note. The Maine CDC is reporting 3 additional deaths today. One of them was a resident of Cumberland County, another a resident of Oxford County, and a third a resident of Washington County. 2 of the people who died were men, and 1 was a woman. 1 was in their 60s, and 2 were in their 80s and over. These 3 passings bring to the total number of those who have passed away with COVID-19 in Maine now to 639. We'd like to take a moment to offer our deepest condolences to all of the friends, family members, and communities of all 639 people in Maine who have died with COVID-19 over the past year. Right now in Maine, there are a total of 41,630 cases of COVID-19, representing an increase of 211 cases since yesterday. Of those, 33,301 are confirmed, 8,329 are probable cases. Cumulatively, 1,450 people have now been hospitalized, and in the past 30 days alone, 220 Maine people have been hospitalized. Right now in our state, 117 people are in the hospital with COVID-19. 24 of them are in a critical care unit, and 13 are on a ventilator. Among all of our 41,000 cases, 3,964 have been among healthcare workers. I'd like to turn next to a discussion of where we stand with testing. Right now in Maine, the 7-day rolling average of PCR tests that have come back positive, the PCR test positivity rate, now stands at 2.5%. The testing volume for PCR tests is at 573 tests per every 100,000. Turning now to antigen tests, where the 7-day positivity rate stands at 4.8%, and the antigen testing volume is at 132 such tests for every 100,000 people in the state. Turning now to vaccinations. Cumulatively, Maine has now administered over 200,000 doses of COVID-19, 200,927 as of this morning. Of those, 145,894 are first doses, and 55,033 people in Maine have now received both of their doses of COVID-19 vaccine. To put those numbers in perspective, 15% of Maine people have received at least 1 dose of the COVID-19 vaccines. And as of this morning, just over 4% of Maine has received both doses. And finally, a couple of updates on the outbreak front. First are 2 outbreak investigations that Maine CDC has opened in the recent day. One is an investigation at Orchard Park, a long-term care facility in Farmington, where we are aware of 19 cases of COVID-19. The other is at Tall Pines, the residential portion of Tall Pines, where we are aware of 5 cases. Many may remember that just under a year ago, Maine CDC worked very closely with the staff of Tall Pines in an outbreak that occurred again just under a year ago as we were working and learning more about COVID-19. I would like to stress that the outbreak that I just noticed here or referenced here is not in the nursing care portion at Tall Pines in Waldo County, but rather in the residential care portion. As with all outbreak investigations into congregate care settings, Maine CDC is focused on a few things. First, making sure that the staff have the appropriate levels of PPE. Second, making sure that testing is widely available to all staff and residents who have potentially been exposed. And then the third, working with facility operators on infection control practices to limit the potential spread of COVID-19 within any facility. And finally, before we turn things over to questions, I'd like to take just a moment to talk a little bit about the decision-making process that underlies how we approach vaccines and vaccinations. Overall, what Maine CDC, Maine DHHS, and the state of Maine overall do is to start by assessing federal guidelines around who should be vaccinated and with which vaccines. We then take those guidelines and measure them against their appropriateness, their applicability to Maine in light of our state's sometimes unique needs. For example, geography, the ability to make sure doses can maintain the cold chain throughout their journey, so on and so forth. We then couple those federal guidelines with input from a variety of stakeholders, medical experts, healthcare officials, advocacy organizations, to just name a few. Maine CDC and Maine DHHS work together to then develop recommendations using those federal guidelines as a starting point. And we then present those recommendations to Governor Mills. Governor Mills makes the final decisions on vaccine strategy as well as allocations. The governor has publicly stated during these meetings what her approach to vaccination strategy and allocation is. As Governor Mills has stated, her decisions are based on science with the overarching goal of saving lives. For example, we know that both in Maine as well as nationwide, those 70 and older are the most likely to suffer from and sadly die if they happen to contract COVID-19. And that is why Governor Mills has prioritized those 70 and over at this stage in light of the limited supply of vaccine we have available. Now, we will have additional updates on how we are approaching and thinking about vaccine allocation and vaccination strategy in the future, particularly in light of the Biden administration's continued efforts and success at increasing the allocation and supply of vaccine coming into states. As that supply continues to increase, we will continue to provide updates on how we are thinking about vaccine and vaccination allocations across the state. Right now, however, supply governs speed. The more vaccine supply we can get into the state, the more quickly we can move it into the hands of providers who can move it into the arms of Maine people so that we can start achieving widespread universal or widespread vaccination coverage across the state. So with that, Commissioner, unless you've got anything, I'm going to go ahead and turn it over to some media. Oh, I'm sorry.
I do have something.
You do have something, and I knew that, and I forgot about that. My apologies, Commissioner. Over to you.
Well, speaking of supply, I am happy to announce that starting on Friday, February 12th, residents will have a new option for getting COVID-19 vaccines in Maine. 24 Walmart and Sam's Club's pharmacies throughout the state will begin administering the vaccine through the U.S. Federal Retail Pharmacy Program. More than 1,000 Walmart and Sam's Club's pharmacies in 22 states are receiving federal vaccine allocations this week, separate from and on top of the allotment that states receive, with an emphasis on locations that reach customers in underserved communities. While initial vaccine supply is limited, Walmart and Sam's Club pharmacists and technicians stand ready to expand that vaccination across the country as additional vaccine doses come on board. This is an important step in our efforts to get shots into the arms of as many Maine people as quickly as possible, as Governor Mills has said. This partnership, coupled with increasing supply of vaccines from the federal government, will help us save the lives of Maine people most at risk from suffering and dying from COVID-19 and get our state back to normal. Eligible Maine residents can schedule a vaccine appointment starting this evening via Walmart and Sam's Club's websites, making it convenient to get an appointment at these sites, which will be open beginning Friday. So with that, I would also recommend that people look at Maine's vaccine website to find additional sites for a vaccine. But with that, I'll turn it back to Dr. Shah for questions. Thank you.
Great. Thank you very much, Commissioner Lambrew. We will turn to some questions, and the first one for the afternoon goes to Patrick Whittle from the AP.
Thank you very much, and happy Tuesday. The Portland Press Herald has done some really good reporting over the last few days about vaccines that were administered to out-of-state consultants at Maine Health regarding a union organization drive. I would like to know what kind of a role the state can play to prevent something like this from happening in the future, because we have a state that's largely full of people who are being patient and playing by the rules, and then the state's largest healthcare provider hands these coveted vaccines to a bunch of out-of-state consultants, and numerous aspects of that look pretty bad. So is there a role for DHHS or for the state to play in making sure that this kind of line jumping doesn't happen going forward?
Sure. Thank you for that question. Ensuring that people have confidence, first and foremost, in our vaccine plan and administration is at the top of our minds. We appreciate the fact that the supply is not coming fast enough, that there are vulnerable people at risk of serious illness or death from COVID-19 that are still waiting for that vaccine to be scheduled, the appointment to be scheduled, or the sites to open. This means that we will continue to be more aggressive with our providers to ensure that they are following the governor's guidelines, which, as Dr. Shah mentioned, are set based on the need to save lives. We do know that older Mainers, people aged 70 and older, are the ones at most risk of death. While we've gotten fairly far in vaccinating them, we're close to 30% of our older people ages 70 and older who've gotten their first dose of vaccine. We have a long way to go. As such, we are reiterating that our guidelines are requirements. We are saying in multiple forms of communication that failing to follow these guidelines could be a violation of the provider agreements, which set up the terms for them getting the vaccine. And we continue to underscore that our plan, which right now is simple, people ages 70 and older, is designed to save lives. We continue to try to work with our providers to make sure that they understand these rules. We will, as needed, increase that accountability and integrity of those programs. And we do hope that, again, with the supply expanding, as Dr. Shah mentioned, from the Biden administration, we can quickly get to additional people.
Thanks, Patrick.
Okay, thank you very much. Can I just throw out one more quick thing?
Sure.
Regarding, pardon me, regarding the Walmart initiative, you mentioned, Commissioner Lambrew, that this is on top of the expected allocation. So this is outside of the sort of the updates we've been getting every week of how many doses are coming into the state. Yes,
it is on top of the weekly allocation that we announce every week. We do expect that there could be up to 4,400 up to 4,800. We're still trying to finalize those numbers. Additional vaccines that will be coming to these Walmart and Sam's Club stores each week. And I should just underscore that these are vaccines for people ages 70 and older. This is not yet beyond the same tiers that the governor's already announced. So we're hopeful, again, that the online scheduling system will be ready to go this evening with appointments available beginning Friday.
Okay, thank you so much.
Thanks, Patrick. Let me turn it over to Patty White next.
Thanks very much. I've got another question about the retail pharmacy program. So it's going to go to 24 Walmart and Sam's Club pharmacies initially. Is that going to expand to other locations and other pharmacy chains or independent pharmacies?
Sure, it may, Patty. Right now, that depends on, and you referenced this in your question, but this is Maine's participation in a federal program that the US CDC is operating. And so if the supply of vaccine allocated to that program were to expand, we may expand it to other pharmacy types or pharmacy chains here in Maine. Right now, Walmart is able to utilize fully within 1 week the supply that's being allocated to Maine for that program. If that were to go up, then we would look to expand it potentially to other programs, or I'm sorry, other pharmacies, depending on what their geographic coverage is in the state.
Okay, thanks. And then you've been asked about this, but I want to ask again. The Maine Education Association in recent days has called for teachers to be prioritized in the state's vaccine rollout to help schools fully reopen. Considering that other states have made teachers eligible for vaccines, are there any plans in Maine to move teachers to a higher tier, or can you give any indication for where in the rollout they're going to land?
I'll start, and then Commissioner Lambrew, please weigh in as well. As we've referenced even just today, the supply of vaccine remains incredibly constrained. Governor Mills has prioritized ensuring that those who are at the highest risk of severe disease or death be those who are in line right now for vaccine. Right now, that's those 70 and older, for whom there are 193,000 people just within that 70 and older category. The other thing that I thought was instructive, Patty, was late last week, the US CDC director, Dr. Rochelle Walensky, noted that schools overall have been safe for in-classroom education. And I found something that she said in that regard to be interesting, which is that vaccinating in schools is not a prerequisite to having schools be open and be a safe place when it comes to COVID-19. And I thought that was instructive. It squares with the experience that we've had in Maine. It squares with the experience that's been seen nationwide, which is that owing to adherence to measures like distancing, masking, so on and so forth, schools can be a safe place, even separate and apart from vaccination.
Okay, thanks. If I could ask one other quick question, it's about independent primary care providers. And I know I've asked you about this before, but there's some out there that really want to be involved in administering doses now, and they're seeing some sites, vaccination sites, get 100 doses a week, and they're kind of wondering, if some sites are getting a smaller amount, why can't they? Even though the focus is on high volume, high throughput, they're saying they could add to that because they would capture patients that are either unable or unwilling to go to some of those larger sites. Are there any plans to involve independent providers, sooner rather than later?
Sure, I can start there, and I hate to recycle the first part of my answer, but it's somewhat structurally similar to the prior, which is the supply of vaccine remains incredibly constrained at this time. And that is, again, governing and constraining many of our own allocation decisions within the state. If the supply were much, much more robust, as it is for so many other vaccines out there, the flu shot, MMWR, so on and so forth, where there is not a supply challenge, then of course we want to push vaccine out to every corner of the state. But given that we are still very supply constrained, we have hard choices to make with respect to the recipients as well as the administrators of vaccine. You are correct, Patty, that there are some locations that are receiving the minimum allocation size of 100 doses. But even those are not independent solo medical providers. Those are federally qualified health centers, clinics that can put on and host larger numbers of people for vaccination. So we are not leaving doses unused at the end of the week. We've been working with the medical associations to think about how we incorporate individual independent medical providers. But at this time, our focus is making sure that every dose that comes into the state on Monday morning is used as quickly as possible so we can get as many folks vaccinated. And we know that's something that large throughput centers and federally qualified health centers can do without any waste whatsoever.
Thank you.
Let me turn it over to Brian Sullivan next.
Thank you, Dr. Shah. I would wonder about the Walmart and Sam's Club program. Is that the signups where it's going to be over 4,000, or we hope each week? Can people sign up down the line, or is it just a 1 week amount of availability for people?
So Brian, the answer is that they can sign up for slots in the future. It's not just within the subsequent 7 days. They can sign up in the future as well, beyond that 7-day mark. So,
and then I guess I'll just, play the hits and wonder how are we coming with the statewide registration system, and when that does come, I would wonder, is that open to anybody to hop in line to get, or is it still going to be just age-based and, as needed, or as the state has decided, or people are eligible for?
Sure, Brian. So we're making progress. We're working with the vendors. Right now, the focus is on ensuring a good connection and ensuring harmony between the online platform and the call center, because they are different entities that are going to be working on those things. But we've got to conjoin them and make sure that what the online platform is doing is something that the call center agents can utilize easily, making sure that any questions they've got are answered. So that's where we are in the process right now. We're making good progress, but any undertaking of this effort to pull together two disparate vendors, one of which specializes in an IT platform, the other of which specializes in phone-based customer support, and having them all sync up so that it's seamless no matter where you call, you're having the same experience. That's a challenge. Again, Commissioner Lambrew and I have said we'd rather do it right rather than do it fast and wrong. I know that means more frustration for folks. We understand that. We are working as hard as we can to bring something online. I'd say we're still on track, but it's still going to take more time. In terms of the registration / pre-registration, Brian, there are two separate components there. One is the pre-registration, which will be open to anybody. You can signify that you are interested in learning about when a vaccine is available, when your phase, your place in line comes up. The other piece of that is registration. If you are someone who is 70 and older right now, who is eligible for vaccination, then you can sign up to look for a spot. So those are somewhat distinct, but we want to have one unified place for anybody to go, at least as to the state-supported sites that we're focused on.
Thank you.
Mm-hmm. Let me turn it over now to Amy Brown.
Thanks, Dr. Shah. I have a couple of questions about the vaccine rollout too, but just real quickly, first, do you have any updates on the outbreaks at Crossroads to Calvary Church in Morrill or Harbor Hill in Belfast?
Nothing significant as to either of those, Amy. From an epidemiological perspective, at the Crossroads to Calvary Church, the case count stands at 23 right now, and at Harbor Hill, it remains at 4. So no significant increases as to either of those.
Great, thank you. Phase 1B includes certain critical frontline workers, and Phase 1C includes other critical frontline workers. And the state's website says those categories have still yet to be defined. So wondering when that will be done. And also, you were talking about people pre-registering so that they're indicating that they are interested when their turn comes around. But one of the things with the registration systems that currently exist is they don't ask, or at least not all of them do, about medical conditions that would put somebody in a different phase, or occupations which have still yet to be sorted. What is critical versus other frontline worker? So we're getting questions about that. How are they going to, as you move into the next phase, know if somebody has the medical condition, if they're registering with one of the big health systems and that isn't their primary care provider, or what occupation, or if they have an occupation that puts them in, say, a latter part of 1B as opposed to 1C?
Sure, Amy, that's a good question. So we've been thinking that through. Right now, I mean, as to the former piece of your question, there haven't been any final decisions about the frontline versus other essential. You've heard the governor's distaste of the word essential. So frontline versus non-frontline, but yet still critical workers. No final decisions as to what the composition of those groups may be and when we may be at that point. Again, we are still very, very supply constrained, still only getting on the order of 20 to 21,000 new doses per week, and still over 150,000 or so, 140,000 just among the 70 and older population. So a long ways to go there. And that's why we're studying what makes the most sense from an epidemiological perspective. In terms of the pre-registration piece, we're still sorting through how someone can register given what we know the phases to be. There's not going to be a final answer until we really go live with it. It may be that folks have to update their profile as we go through. We haven't finalized how that will work at this time.
Okay,
I
great.
do want to add on that topic though of pre-registration that we have gotten concerned or concerns have come to us about some of the sites that have pre-registration that do indicate occupations or medical conditions, which is premature. So we are discouraging that kind of activity in advance of decisions, not because we don't want to vaccinate those people. We want to vaccinate everybody, but we fear there's some fear that if you don't quickly go to one of those sites that might be pre-registering teachers, for example, you won't get vaccinated. That's not true. Number one, we will get to everybody, and we will be clear when we get to those different phases about who is eligible and how to sign up. But most importantly, we want to, accomplish what is at our feet this second, which is we still have many more older Mainers to get to, including those that are in rural areas, may have challenges getting to some of these sites. We have a lot of work to do to get through the 70-year-olds, then to the 65 to 69-year-olds. And as we approach those phases, we will be crystal clear about what comes next.
So will the information for people who have already registered on some of the existing registries be moved automatically onto the state's registry when that's up and running, or will people need to re-register?
Depends on which site we're talking about, Amy. There are different healthcare systems with different registration platforms. We also don't want to supplant those because they've been up and running and they've shown success. So the question is how we harmonize them rather than just replace one with the other.
Thank you.
Let me turn it over to Kelly Bouchard from the Press Herald.
Thank you, Dr. Shah and Commissioner Lambrew. We're hearing from a lot of readers who are upset that Maine Health vaccinated non-patient facing staff before other groups, especially seniors. But other healthcare networks have said they did the same, including Northern Light and Central Maine, and they were following Maine CDC guidelines at the time that were later changed. My first question is, what are the actual penalties or consequences for hospitals if they don't follow CDC guidelines? Or is Maine CDC beholden to hospitals because they have taken on such a major role in the vaccine rollout so far?
Maybe I'll begin just to clarify for everybody's understanding is, as a reminder, vaccines began to arrive in Maine on December 14th. At that point, we were, because it was the first couple of weeks of this whole process, following the recommendations of the US CDC advisory group that did define healthcare workers as first in that line. About 2 weeks into the process in late December, we did hear and learn that some of the hospitals had been quickly going through their patient-facing employees and were going to turn to the non-patient facing employees. We indicated our concern, our strong concern about that when we knew that there were community-based doctors and nurses who had yet to get vaccinated because they were not part of a hospital system. We then worked with those systems, including Maine Health, to move vaccine to those community-based providers to ensure that they had the opportunity to be vaccinated, since they were coming face-to-face with patients and people, with COVID-19. And we did clarify a few days later in December that that was our policy, patient-facing providers first. In light of continuing shortage of vaccine, we then removed that group altogether, that group of non-patient facing healthcare employees out of 1A, in recognition of the fact that we just didn't have enough vaccine and we wanted to prioritize older people at risk of severe illness and death. So we did adjust our guidelines as we went along in light of circumstances. We disagree with an ongoing effort or ongoing activity that is not in compliance with our guidance. We do have provider agreements with these organizations as a condition of those provider agreements to follow our guidelines. And we do have a commitment from Maine Health and other organizations that had been doing a group that was not consistent with the guidelines, that they would do that going forward, do so going forward. Again, as I said earlier, we take seriously that there's many people who are eligible for vaccines or not yet getting it, and it's our job to do our best to move vaccines to places that will vaccinate those people who are eligible today.
Okay, as a follow-up, can I ask, Maine CDC has said it's been clear with hospitals from the start about its expectations or requirements, but guidelines have shifted and problems have resulted. And we're wondering if Maine CDC bears any responsibility for the problems that are cropping up.
I'll just say this, Kelly. Guidelines have shifted. That's the nature of being in a pandemic and rolling out a mass vaccination program across the country. The fact that guidelines have shifted does not mean we have not been clear about what our position is and how those guidelines should be applied across the state. I think we've been crystal clear about that in our public communication as well as in our communication with others.
And I'll just add that not only do guidelines get adjusted for circumstances, the circumstances change. As a reminder, we got in the second week of distribution 32,975 doses. The following week, that was cut like almost in half to 19,000. The week after that, it was lower. So when we're faced with circumstances that require us to change to target vaccines to people who need them most, we will do that. We did that, and we will do it again as needed.
Thank you very much.
Yep. Thanks, Kelly. Let me turn now to Brad Rogers.
Hi, Dr. Shah. Can you hear me okay?
Yep, sure can, Brad.
I've got a question from a woman. She's a retiree named Mary Altenburn, and her husband has been in a long-term care facility, and she watches you all the time. Her contact with her husband has been limited to the end of a 6-foot table, and now it's through a glass door. And she's waiting for her second dose. Her husband has been fully vaccinated for COVID. She wants to know this. Does the CDC have plans to reopen long-term care facilities to fully vaccinated family members so to allow them to visit their fully vaccinated loved ones?
Sure, Brad. Go ahead.
Maybe I'll begin because from early days of COVID-19, we've recognized the challenges as well as the suffering that has resulted from people not being able to visit their loved ones, their friends, their families in nursing facilities. We've striven to tier our guidance to nursing facilities so that in areas with low incidence of COVID-19, there can be greater visitation policies, as in guidelines that we put out last fall when we were able to begin to calibrate that. We are now upping our testing guidance, so we are testing more nursing facilities as well as choosing to prioritize those residents for vaccines. So the vaccine effort is going along. It is making progress. We are getting to the majority of all long-term, skilled nursing facility residents who've been vaccinated. And we are hopeful as we get a little bit further, we can adjust those policies so people can safely revisit their loved ones. But again, this is contingent on trends continuing to be good, the variants not coming to Maine and causing our case rates to rise. So it is all still subject to change, but we absolutely share the goal of reuniting families and residents in nursing homes, and we'll do so as soon as is safely possible.
Okay. She did have one other quick question about a thing called hug curtains, I guess. I don't know if you're familiar with hug curtains, but she wants to know if something like that is available as well.
Brad, well, first of all, hi, Mary. Hope you're having a good day. And Brad, I confess I am not familiar with with the hug curtains. I can imagine in my mind what they are based on the name, but I will echo what Commissioner Lambrew noted, which is we share the goal of making sure folks can hug one another without a curtain in principle, and it may still take some more time for us to get there. Getting enough folks vaccinated and having enough data to show that everyone who's been vaccinated can get together in a safe manner. I know that that's something that the US CDC is looking at and studying. The last thing that we would want is to take a chance in a scenario like this, and a chance that could result in an outbreak being precipitated. So I've been in really good contact with officials at the CDC to see how we can do this and when. It's not a question of if, it's really a how and when question.
All right, thank you so much.
Yep, Brad, thanks. Let me turn it over to Caitlin Andrews next.
Good afternoon, Dr. Shah, Commissioner Lambrew. Can you hear me okay?
Yep, sure can, Caitlin.
Awesome. My connection just timed out there, so if I disappear in the middle of it, that may be why. My first question, we want to drill down a little bit more on the Walmart and Sam's Club shift after their suppliers told them about the planned move. The understanding we heard from some retail pharmacies was that this could result in smaller pharmacies not getting increased number of doses. Can you walk us through the practical effect of this change in the state vaccination scheme?
Sure, Caitlin. As the commissioner noted, this is Maine's participation in a federally operated, US CDC operated vaccination program. And thus the supply of vaccine that is being allocated to Walmart in Maine's case comes from a separate and distinct supply than which comes into the state and which is allocated by Maine CDC and DHHS. So for example, independent pharmacies with whom we have been working now for weeks to vaccinate residents and staff of long-term care facilities. Those independent pharmacy allocations come from the state allocation that comes directly to us, not from a specific federal allocation, which is where the Walmart allocation comes from. Thus, we don't envision that our participation in this federal program via Walmart will affect what happens to other recipients of vaccine in the state.
Okay, thank you for that clarification. And then my second question, and it feels like we're all just kind of talking about the same topics today. So I want to talk about the state's planning for its frontline workers in 1B. You know, I know we talk so much about the supply being constrained. It's constrained all over the country. But other states who have these folks in their phase 1B have been more specific about who that's going to include and when they're going to be there. Many also seem to be following ACIP's guidelines. So I guess I'm trying to understand like what is stopping Maine from being more specific at this point, or are other states moving ahead too fast, in your opinion?
Maybe
go ahead.
Maybe I'll just begin by saying, you know, we believe that it makes sense to focus on what is directly in front of us. We must finish vaccinating those long-term care residents and staff that we just discussed because of the high risk of outbreaks and death in those facilities. We must finish vaccinating our 70-year-old and older. Again, we may be close to 30% with our first doses. We're not that close on second doses. We're not all the way through on, you know, that even on first doses. We have a long way to go there. And then we have our 65 to 69-year-olds. As we previously described, those circumstances change. So we want to be, rather than over-promising and over-committing to what comes next, finish what we started, prepare for what's next. And as we are doing so, opening up more sites, getting that central phone system and registration system, gearing up so when the supply comes, we will get those shots in arms, which may, if we're able to do that well and the supply expands, change our ability to choose who comes next. So it could be a lot smaller or it could be a lot bigger. We'll be ready either way. But again, Governor Mills has been crystal clear. We must protect people's lives, and doing so means completing our task of long-term care residents as well as older Mainers.
Caitlin, I will only add on that. I think our demographics demonstrate that approach, focusing on the elderly and starting there and doing a good job and making sure we are rounding that group out. I think just any glance at our demographics will suggest that's the right place to start. And then to add on to what the commissioner noted, you know, I think our MO throughout the pandemic has been to be really pragmatic. We don't know what our vaccine supply will be more than maybe 2 weeks in advance right now, maybe 3, but even that becomes hazy. Given that somewhat that uncertain horizon for our vaccine supply, our focus right now is what do we have right in front of us with the vaccine we've got and those who we know we can vaccinate immediately. So much could change just in a couple of weeks in terms of other vaccines that are available, other avenues and mechanisms through which to vaccinate them, that we're going to wait and see and take that pragmatic approach that we've taken throughout the pandemic.
Your last point there was actually kind of addressing my follow-up question, is that, like, you know, what, how could those elements that you just talked about, how could they drastically change what the state would choose to do in terms of vaccination? You know, given how we've seen the pandemic roll out so far, and how we know who it's affected, things like that.
Yep, let me give you a very concrete example. J&J has submitted an application for emergency use authorization for their COVID-19 vaccine candidate. That vaccine differs in material ways relative to the two candidates that we have right now, Pfizer and Moderna. Namely, it only requires one dose, and it does not have the stringent refrigeration and frozen, ultra cold freezing requirements that the Pfizer does, to say nothing of just the regular freezing requirements the Moderna does. That is to say, it's one dose and it's a lot more portable. That vaccine, if it is authorized by the FDA after their thorough scientific review, which is underway right now, if that vaccine were authorized and made available to states in sufficient quantities, it opens up a brand new front for us in our approach to vaccination. It means that vaccine can be distributed much more easily. It can be outside of that frozen environment for a longer period of time, and we can focus on a population for whom we don't have to zero in on the second dose. That is to say, that first dose opportunity, that's a brand new and different population in some respects than the populations and the venues we're using right now. Large scale folks that we know that will be able to come back for their second dose. So if that vaccine is authorized and it starts arriving in states in sufficient quantities, that's not a game changer. It's just a different game altogether. And so that's why we will wait and see, based on things like that, where we go.
Okay, thank you.
I have a ridiculous analogy, but not for today. I'll save it for another day. Let me turn to Rebecca Stefanski from Maine
These
Center.
ridiculous analogies are great.
No, not for today. Not for today. Let me turn to Rebecca Stefanski at News Center.
Thank you, Dr. Shah. I have a couple of quick follow-up questions and then a question of my own. Regarding vaccine guidelines, what are the enforcement tools available to the state to help ensure that these guidelines are being followed?
So I'll begin by saying, as a reminder, the US CDC and the federal government has procured these vaccines. They're not free in the real world. There is a cost to them, and the federal government paid that cost. It has agreements with states and with providers about who can provide it, how they can provide it, and what are the guidelines for that. The state of Maine has made it clear that if you are getting vaccines, directed from the state of Maine, you must follow those rules, and those rules include following the guidance that we have. So we do ultimately have kind of the ability to redirect and move vaccine, as you've heard us talk about repeatedly on this call, when it's either not being used quick enough or not being used consistent with those guidelines. We also just will continue to work with our providers. I mean, again, I do want to say, the Maine healthcare provider community has shared our goal of trying to quickly and effectively get shots in people's arms. So, the vast majority of vaccines that have been administered to date have been done so with that goal in mind. But when we see problems or examples of problems or systematic concerns, we will obviously address them, get that commitment moving forward to follow the guidelines, and continue our large-scale goal of getting as many people vaccinated in the state of Maine as possible.
Okay. My other follow-up question regarding consideration of visitation policies for long-term care facilities, skilled nursing. When making those considerations, is vaccine administration to staff members a concern with that? And what has been the uptake percentage of staff members that work at these facilities?
I'll just say one word and then turn it over to Director Shah, which is yes. The answer is yes. Staff, getting the staff at the skilled nursing facilities and other long-term care facilities vaccinated is critical, because as we know from our experience, it oftentimes is the staff that can bring COVID-19 into those facilities. As you probably know, there's not a constant staff. There's staff turnover, there's new employees, there's changes. So it's not a one and done. There'll have to be a constant effort to look at whether and how and whether to get all those, I should just say whether we get all those staff people vaccinated in a timely way. That is definitely a consideration. We also are under guidelines from the federal government. The Centers for Medicare and Medicaid Services does have rules about visitation and guidance that we're also keeping an eye on, because they are the ones who began to give states guidance on this. We have actually tried to be aggressive on visitation here in Maine vis-a-vis the federal guidance, but we also expect that federal guidance to be adjusted in the coming period of time as well.
And Rebecca, as to your latter question in terms of uptake, it's varied across the state, as one would expect, given the number of facilities that we have. Some facilities have reported that they've had very, very high uptake levels among their staff. Others have been lower. We are working with the pharmacies that have been on site to actually conduct the vaccine administration events, those clinics, to get a better sense after they've left a facility, after the first, second, and third clinics, after they've offered vaccine to all of the staff, what the aggregate uptake rate was, because it can vary event by event by event. Not every staff member is eligible on every day for staggering concerns, so on and so forth. So it's really only after everyone has been fully offered a vaccine can we look back and say what the aggregate uptake rate was. But in the meantime, we hear anecdotally, some facilities very high, others have been a little bit lower. One of the things that we've done is to put up videos and to host webinars for residents of long-term care facilities, to speak directly with them, to hear their concerns, answer their questions, and urge them to get vaccinated.
Okay, so now the question that I was going to ask earlier, turning away from vaccines entirely, nearly a year into this pandemic, what do we know about the long-term healthcare effects? And specifically, are there people who may have been hospitalized because of COVID and thankfully were released, but are then being readmitted with other likely related ailments, heart, lung, neurological, things that we've heard? And what are the outcomes of those situations?
Sure. Yeah, Rebecca, that's a great question. It's something that I've spoken with colleagues about. This is an area where there's probably less than we know today than we really need to. The long-term consequences of COVID-19 it seems like every week there's a new article or a new journal article or a publication describing what we know about the longer-term consequences. Let me just summarize a couple of observations that I've taken away from my discussions and some of the literature. Number one is that it's not everybody. Now, the estimates of who have longer-term consequences vary. It seems to vary by gender, with women having a higher likelihood of having long-term consequences than do men. But even there, the range is not yet very, very well characterized. No one's quite sure if it's just 1 or 2 percentage points or whether it might be higher, like 8 or 9, 10 percentage points of all people who have had COVID. The other thing that varies quite a bit is the magnitude of those symptoms. Some folks really report being outright debilitated months and months and months after their COVID diagnosis. Others report milder day-to-day symptoms, just having persistent body aches, things of that nature. And in terms of readmissions, nationwide, and I can see if we can find the Maine specific data, but we are starting to see reports of readmissions from individuals because of these lingering or recurring symptoms. They don't seem to be related to an infection or a reinfection, but rather the body's own immune system starting to be or staying very, very active. And that seems to be what's causing these longer term symptoms. As you note, they can attack somebody in myriad ways. The immune system, the neurological system, the cardiovascular system, all of which can be involved. I think right now there's still a lot of research going on. Indeed, I had the pleasure of listening or getting briefed by a physician at Johns Hopkins in Baltimore who has started a standalone clinic specifically dedicated to individuals who are grappling with these post-COVID symptoms. So it's certainly something that's out there and probably something we'll learn much more about in the coming months.
Thank you.
And the last question for the afternoon goes to Allison Ross.
Hi, Dr. Shah. Thanks so much for taking my question today. So I think all the reporters are on the same page, kind of all the same topics, but just back to who is actually getting vaccinated right now. Now, we've heard dozens of complaints from elderly Mainers just desperate to get a vaccine, and then Of course, they're frustrated to hear that donors and out-of-state contractors are skipping the line. There doesn't seem to be a lot of accountability. So what do you have to say to those seniors, and how are you going to regain any lost public trust here?
Mm-hmm. Well, Allison, let me first by acknowledging that I hear where they're coming from. We've talked about during these meetings how it's not enough for there to be a vaccine. There has to be a process for allocating the vaccine and finding who can get vaccinated that is just as transparent as the process of making the vaccine was. So I hear where they're coming from. We acknowledge those concerns. That's one reason why Commissioner Lambrew and I felt that it was important to talk very openly and candidly about the concerns that we've had, as well as what we see as how we reinforce the principles that the governor has set forth. It's also important to bear in mind that this is a very large scale effort. When all is said and done, there may be 2.6, maybe 2.7 million shots that may be administered across the state of Maine, 660 million shots administered across the country. We are doing the best we can to ensure that every dose that comes into the state goes into the arms of folks whom the governor has allocated it for based on the views that she has expressed. We are working day and night to try to keep that process moving both as equitably as possible, but also as quickly as possible. We know that sometimes those two come into tension with each other. What I want everyone to know is that we are keeping an eagle eye on the situation as best we can. And if there are problems, our team will be poised to interact with folks to respond to those problems and make sure we get things on the right track. The other thing I want everyone to know is that if there are concerns, if there are problems, we will be here to discuss them with you rather than just walking into a hole and not letting folks know where we stand. There will be problems going forward. This will continue to be a bumpy road. Again, we've got 2.7 million shots that ultimately we're going to need to give out. There are going to be bumps in the road, but our pledge to you is that you will continue to hear from us. So when there are those bumps, you can ask us questions and we can provide you answers. Commissioner, did I miss anything? Great. Thanks, Allison. So with that, everyone, I'd like to just end on that same note, which is that, again, to acknowledge that we know that there are concerns out there, and we will do everything we can to stay on top of those, and at a minimum, make sure that you are hearing from us and that we are making ourselves available to you to speak directly to those concerns. Again, there will be more bumps in the road, but our pledge is to stay here and make sure we are focused on them and doing everything we can to get the road as straight and smooth as possible. So with that, I thank everyone for their time this afternoon. We appreciate all the questions as always. We look forward to catching up with everyone again on Thursday. In the meantime, as always, please be kind, take care of one another. We'll talk again soon.